needs that we can look at as we consider options for this budget, then we'll do our best to work with you on that.
Thank you so much, Madam Chair and Council. Please forgive me, I have a slight cold, so I'll try to speak up, and hopefully I won't start coughing, so if I do, please overlook it. Thank you, Madam Chair and Council. We relish the opportunity to come before you. Please just allow me to acknowledge my wonderful leadership team in the back of the room, and also the Metro Social Services staff. For the last 25 months, we have not closed our doors at all during the pandemic. We've not missed a meal through our nutrition program, and we've also not buried anybody. We continue to do indigent burial. We also man the COVID shelter for the homeless. We've done that for the last 25 months, and we continue to do that 24 hours, 7 days a week. And we also are responsible for the cold weather overflow shelter that we man when inclement weather occurs or other emergencies that we might have to open up for. So I just like to take this opportunity to say thank you to our staff. Their commitment, their dedication, their loyalty to this organization and to this city is remarkable. So again, thank you for all your hard work. We really appreciate it. Experts increasingly have noticed the critical role that social services plays in addressing interrelated needs in poverty, safety, opportunity, and overall well-being. Through its core mission and programs, Metro Social Services helps Nashvillians who are experiencing economic hardship and a persistent inability to make ends meet because of structural poverty. This form of poverty can be multidimensional and result from long-term processes of inequality, persistent exclusion, concentration of economic power, access to wealth building and social capital, as well as broad transformations in work and society. The most recent survey conducted by the Federal Reserve Bank showed that almost 40% of Americans do not have $400 for an emergency if it occurs in their family. They don't have access to cash, credit, or any other means of the $400. A recent report by the Financial Health Network reveals that a majority of Americans, 67%, are not financially healthy. Another survey reports that mental well-being is inherently connected to financial wellness and is a major cause of stress. As the economic experiences recessions and turndowns, as rent increases and prices out our seniors, and there's a 40-year high in inflation, many households are reaching out to us that have previously not sought assistance. The needs in meeting the city's social and human needs are many, complex, and they're growing. Nashville continues to see dramatic growth from new residents and companies coming into Davidson County. This growth puts increasing pressure on families who have called Nashville home their entire lives by putting greater strain on existing infrastructure, including physical and social services and family budgets. The past 2 years have stretched Nashville in new and challenging ways. The tornado, the flood, the pandemic, the recession, and a civil rights call for addressing inequality. Metro Social Services exists with the goal of mitigating the effects of economic hardships in order to ensure the overall economic and social well-being of individuals and families. Metro Social Services has become adept at making small resources deliver outsized benefits for the people of Nashville. But even now, where the agency's budget is only 0.03% of the city's budget compared to 2 decades ago when it was 1%. We recognize the investments that are needed, and we want to ensure that increasing populations with severe economic needs are offered essential services. And at this time, I'll turn it over to Jay Survey to speak about homelessness.
Volume okay? Oh, good.
Keep it close.
Good evening, everyone. Madam Chair and council members, thank you for having us tonight. We appreciate your dedication. I've been here almost 27 years, and your dedication to our city has gone a long way in our response, especially in the past 2 years, how we've had to recover from that pandemic. And I just appreciate each one of you being who you are. Thank you. I want to take a moment to thank Director Pratt for her continued support and leadership in this role that I am filling in as the interim. I want to thank April Calvin for stepping on board and coming in to a time where homelessness is critical, and her expertise has leaned in and helped us mitigate a lot of policies and procedures that we are looking at. I want to thank all the employees at the Homeless Impact Division that show up each and every day and do the work and produce a positive product for our community and those that are most vulnerable. And I also want to thank our nonprofit partners that exist and work each and every day hard, boots on the ground, and provide a multitude of services for those that are experiencing homelessness. So thank you for your partnership with our city in mitigating this critical issue. We are in unprecedented times when it comes to homelessness, and timing in homelessness is critical. Programs such as the Homeless Impact Division, coordinated entry, landlord engagement, and outreach, and let's not forget the overflow shelter each and every winter. Those programs are vital to the collaboration and coordination efforts that go along with the city and truly bond and bind together nonprofits, so private and government coming together to accomplish a mission. And that mission is for those that don't get to go home tonight. Let's see, sorry, lost my place. Passion gets in the way sometimes. With your support, the programs can be better enhanced and ultimately go towards housing people, Housing First initiative, and saving lives. As the planning and coordinating agent for the COC, we have seen some significant progress in the past few months with the landlord incentive program offering more public supported housing units, low barrier units for us to be able to get folks into, where we have a focus on that 0 to 30% AMI. The hardest to house in Nashville are being housed through this program. The creation of the data dashboard and the data communication, although it is not complete and still being refined, it is a positive progress, and I've seen that in the past several months of how forward-moving that process is getting. And then, of course, next Tuesday, the opening of our new 90-unit public-supported housing. We're celebrating that in our office and in a city, and I think we should all get together and celebrate that moment Tuesday as we provide more housing for those that are in need. And then, of course, the House America program, looking to partner with federal agent funding to be able to provide even more units, more public-supported housing units to provide for those in need. But while we have made progress, we still have a ways to go, as you all know, because I get to talk to most of you through email and phone calls each and every day. So we have a ways to go, and we are up for that challenge. Director Pratt's staff steps in to help, so I'm deeply appreciative to them for supporting us when we are in an emergency type situation. They have never said no and answered the call every time. Excuse me. Your support will get us there. And I lean on you and our city, and I truly believe that homelessness and mitigating homelessness and housing people that need shelter or are yearning for even a handshake of hope, I believe as together in a collaboration effort between city and private partners that we can accomplish major goals in the next few years. So I look forward to working with you, and thank you for the time on the floor. I'll turn it back over to Renee Pratt, Director Renee Pratt.
Thank you. And I'm sorry, Chair, I did not answer your question. Yes, the budget will meet our mission for next year.
Great to hear.
In closing, we would just again like to thank you for this opportunity. Our concerns now is to look post-pandemic. It would be remiss of me as a social services director not to anticipate what's to come. That's why we've been very thorough and very thoughtful about our budget. I did not ask for additional positions last year in the midst of COVID because at that time we did not actually know what we needed or know what we were going to face. We've gathered the data, we've done the research, and we look at our numbers. Our call volume is up 25%. Last month, we received almost 700 calls, and that's only on 2 lines. That does not include customers that are calling to come in for services as well. So we are looking post-pandemic, and we are asking you to be very thoughtful with us around our budget, and we want to be good stewards of the resources. So again, thank you so much for this opportunity and this time.
Thank you. I have a few questions while other people are beginning to raise your hands. Let me write that down. First of all, and as you probably know, we're having a meeting tomorrow to get the results of a study that was requested by this council on perhaps creating a separate division of homelessness services, I think would be the name of it. If and we don't know yet what that report will be, but is there already planning around how that would be integrated with what you do or how that might be peeled off from what you do? I'm not even, again, we don't know what the results are going to be, but will this budget be flexible enough to incorporate what those results are or what those recommendations are?
I would hope so, although we don't know what those results are. There will be recommendations that come along with that study. So I would hope at that time that we will be informed of the role we play and how we work to collectively to make whatever those recommendations or those outcomes work for the city. We want the best results for Nashville. And if that's the Homeless Impact Division staying in social services, we will continue to do the great work. And if not, we support whatever the effort is here in the city around homelessness.
Thank you for that. And then so much of what you're doing, I know you frequently partner with nonprofit groups. Is there, and I think this is something we've done studies for in other departments, where the line is between hiring a nonprofit that does something very well already as sort of a subcontractor of you and where it's appropriate to add staff for you to do in-house. Can you kind of speak to, for example, when Open Table is a great group to have be the contact with people in encampment, for example, and when it's appropriate for those to become employees of your department?
I'm going to let Jay Survey speak to that. I will state that we are in partnerships and have been with Salvation Army, which is another community partner of ours, around sheltering. Again, you are correct. Open Table, they do an excellent job with outreach, and we work very closely with all the outreach organizations in the city and have weekly meetings with them. So I'm going to turn it over to Jay to respond.
Let me go back. The public supported housing is a groundbreaking, not an opening. So that's next Tuesday for the groundbreaking. Let's clarify that. So still excited. We need to celebrate. Can you repeat the...
So just my question of how you decide when it's appropriate for you to hire employees and when Salvation Army is the boots on the ground. Where's the dividing line between us paying people or just having it part of your budget to contract that work out?
Contract out. Well, first, a needs assessment of where we are, and is our staff at that moment able to keep up with that demand, which we've seen an overwhelming demand in our community in the past 2 years. But to answer your question directly, we would put that up for an RFP. So just for example, like the co-weather shelter, let's go there, right? With the co-weather shelter, the services that are being provided that I commented on earlier about the social service staff that steps up each and every time that we are open, Director Pratt's services during the day suffer from those folks coming to help us work at night. So that's what I'm talking about, a staffing issue. When it's truly a staffing issue, when we know that we could do better by contracting it out and still provide and not take a detriment to the critical services that are provided during the day through the different programs that she mentioned earlier, that's when we need to look at an RFP to contract out for that staffing need.
Thank you. That's helpful. And then, since you brought up the cold weather shelter, is there space in this budget to look at expanding the nights the cold weather shelter is open beyond, I think 28 degrees is the current threshold, and we've had advocates asking for 32 degrees?
I'm pleased to report this past winter, we did stay open extended days and hours. We opened not only during inclement weather, we did open during inclement weather, but we also opened during floods, tornadoes, and that generally doesn't happen. We were very fortunate to receive some additional funding through the ARP funds that we were allowed to use to open the shelter for extended days and hours. So we do want to sustain that if possible. We were open several days over the winter, and the temperature was 32 because it was below going down to 28, which is when the shelter actually opens. So we were open those extended days, those extended hours, and we hope that we can sustain and continue to provide that service through those sheltering processes with partners and also our sheltering process, social services.
Great. Thank you so much. Councilmember Nash and then Suara.
Thank you, Madam Chairman. Bless you all for the work you do for the disadvantaged here. The new supportive housing. I'm familiar with a project in Seattle called the East Lake House, and I've provided some of the information on it to different chairmen of our housing people. But they were very strategic in picking the tenants. They had done some research and decided who had the most ambulance calls, who spent the most time in jail, who went to the emergency room, and actually picked those people that used up the most services in the city and put them in that supportive housing, and actually saved the city something to the tune of $5 million the first year, getting these people in some supportive housing so they're not out on the street and facing the problems they face. And I just wondered if you have any criteria similar to that for your first tenants when it gets here.
April.
Hi there, I'll speak to that. Thank you for that question. That is a great question. Definitely what we would use is our coordinated entry program. And through coordinated entry, we would gauge their length of stay, we would gauge their chronic level, the length of time that they've been homeless, plus the disabling conditions that go along with that. I do think that that's a great idea to add that as a factor. How many times they went to the hospital, ambulance rides. There's the VI-SPDAT tool that we use currently that tracks those numbers. We are looking to move towards a different tool, so we would make sure to include that as part of our assessment tool.
Good question. Thank you. Councilmember Suara.
Thank you, Chair, and thank you all for your presentation. And I echo Councilmember Nash, thank you for the work that you do. A couple of questions, and you may have answered it in your presentation, maybe I missed it, or it might even be, this is not budget question, but it might go into it in some ways. So Director Pratt, we've had a conversation a while back about a suggestion for having lockers for people that are homeless, so that at least they have a place to keep their belongings, and that way if we need to move them to shelters, then they're not worried about losing any of their stuff. Exactly. Is that something that we've worked on? Is it in this budget? And if it's not, is it something that we're looking at? The other question that I have for you is that there was also a conversation about maybe an 800 number. So you see somebody on the street that needed help. I think Sheriff Fall said something to the fact that we criminalize homelessness. We call the police instead of calling somebody to help them. And so there was a suggestion about, is there a number that people can call and say, there's this person on this street, do you have the services? And along with that, do you provide services just for the people that come in, or do you actually go out and meet people on the street as well? So if you can appreciate it.
I'll let Chief Survey speak to it as well, but definitely the lockers we did speak about, we investigated to determine and did some research at that time to determine the utilization of the lockers, where they would they be convenient for people, and honestly, homeless have many bags and, things and that they carry with them. That's their personal belongings. That's their home to them. So it's generally hard for them just to part and leave that their valuables to them somewhere in a locker, and then the size of the locker that will be needed to hold some of those belongings as well. So once we did the research, we realized that based on the need, we didn't think the utilization rate would be that high. So, and it did not come back up at the next meeting that we spoke about the process of where the lockers will be, if I'm not mistaken, who would continue to house the lockers and where the access would be to the lockers. And then if I'm not mistaken, what happened after that process, Chief Survey, with the lockers?
Well, we had talked to several of the folks that are experiencing homelessness about that, and like Director Pratt said, they didn't want to part with their stuff, whether it was a locker or not, because the locker was separate from the shelter. But right now, what we do is we allow them to bring their belongings with them and store that for them overnight until we release them when it comes to like the cold weather shelter, and we store that for them that night. So they have become comfortable with that process.
Okay, and I might say that it could be the same thing that we're talking about, because the person that made the suggestion used to be on the street. It was an homeless person that made the suggestion about, if you want me to come into a shelter, I'm worried about my belongings, and so having a place to put my stuff make it easy. So it wasn't coming from me, it's coming from somebody on the street.
Oh, we know. Exactly.
Absolutely.
So, and I think that maybe along the same line is what you're trying to do by saying that come to, especially for the cold weather nights, that will allow you to store your stuff if you do come in.
Yes.
Yes.
We do.
Okay, all right.
Yes.
So maybe it's along the same vein. I just wanted to make sure that
It is.
when we have the
Yes.
people that are impacted giving us suggestion that we
That we
follow into
listen.
in some ways.
At
yes.
first, they were a little resistant, but then a couple of weeks into it, they were very comfortable with the process of us storing their belongings and get them the next morning. We get them, wake them up, feed them, give them their things, and then they had a great stay.
So you're doing it.
Yeah, we're doing it
Great.
without lockers, right?
I think the difference was they were talking about, like, from coming in from the encampments and coming in, if we're encouraging people to come in the shelter, what would they do with their stuff and where would it stay? I think that was the initial question around the lockers and how they would be used.
And the number?
Oh, the 800 number. I did not follow up to know about I don't have any information on the 800 number. I don't think you and I discussed an 800 number, and I was not at that meeting. So I was unaware that that request has been made, so let me apologize for that. But yes, that's something we can look into. Anytime we can provide resource and referral information, that only makes our jobs easier. So if there's a line where people can call and report, instead of calling the police and having the police come out, we would prefer that we have a line that it's a warm handoff, that we can contact someone, or we could possibly go out and meet people where they are. So
Is it possible 311 could be used for that?
that's a possibility, but it would have to, it's so much information, it might be overwhelming for 311.
Might need to have a conversation with Mr. Martini on that one.
I will.
I know some cities use that as a way to.
So I guess as it relates to money and budgets now, the question will be, if you were to have that 800 numbers and man it, what does that look like in terms of funds? Because all of us run into people all the time, and they do need help, and we want to help them. I think having a place for referral to be able to call somebody to meet with them or send them to, I think will help in this process as well.
We will quickly do that research and let you know what that number will look like and the possible costs to put that in place.
And you can send that information to Ms. Darby, who will post it on our budget resource page.
Great.
Thank you very much. 311 cost. Any other questions from council members? Councilmember Evans.
Thank you, Chair, for recognizing me, even though I'm not on budget. But I appreciate, of course, the work that you all do in social services and being one of the representatives on the Homeless Impact Division Planning Council. Appreciate
Thank you for your help. We appreciate you serving on the council.
I've learned a lot being part of the Planning Council and having independent conversations with you all. And I know how hard the work is, and it's another department that we have under-resourced for a while. And I'm glad that you all are able to staff more and that kind of thing. But I guess one question kind of thinking, and this is kind of budget related, because I don't know if this would fit into your budget as it is today, but I know back when we were in the height of COVID with CARES Act money, Metro Action Commission did some kind of more regional effort where they came out into the community to meet people to work on the applications and things like that. And last week we were challenged to ride the bus to come to the council meeting, and so many of us did that. And so one question I saw from a Nashville resident was, well, imagine if you had to not only ride the bus to get to the council meeting, but you were also trying to go and avail yourself of services like what you all offer at social services. And so just thinking of, do you all currently do anything in your existing budget where you're going to the community center and trying to draw people in from an area of town, or is it only strictly they're coming to your office downtown?
No, not at all. It speaks to our budget request. Since the flood of 2010, Metro Social Services has been on the front line of all natural disasters here in the city. We were generally called out on Tier 2, and Tier 2 is after police and fire go out, then social services is called out to stabilize the community and get the response they need to make them whole again. Once that occurs, we go from there to doing case management for those people until they're made whole. So we go out, we're called out on evictions when when a whole community is going to be evicted. We're called out when an apartment complex is closing and people don't have places to go. We're called out when there was the flood. We worked in the community centers because we could not get in our building because it was flooded, but our staff was dispatched throughout the city. Most recently, with the tornado right before COVID, we were in our previous chair's church because we wanted to be in the community in the 37208 area, and we literally walked the community to ensure people were getting and meeting their needs. So we're always responsive. We're generally called out, and we don't mind doing that work at all. That's the work of social services. So we're called out quite frequently on those types of issues and emergency situations.
Thank you for educating me on that, and I appreciate it.
Thank you. Councilmember Hurt.
Thank you, Madam Chair, and thank you all so much for being here. I'm just here baffled about your budget, and I'm seeing that in your general funds budget that it has decreased.
Yes, it has.
Over years.
Yes.
But yet your responsibilities have increased. And I'm trying to figure out how you're doing that. And I heard in your statement that right now you are operating with a 0.03% budget of Metro's budget, and 3 decades ago it was 1%.
Correct.
So, I mean, things are much more expensive today than they were then. So I'm not really understanding how you are able to conduct. Have you reduced your staffing? What has happened that you've reduced, and how are you able to continue to provide such quality services?
Well, thank you so much for that question, and we appreciate your concern around our budget. I have to compliment my staff. I have the most committed, dedicated staff, I think, of Metro employees in Metro government. We couldn't do the work we do without their support, and they've been our support. We only have 13 caseworkers. And as Chief Survey stated, we're responsible to run the shelter during the night, 24/7, and then we're responsible to be open during the day, Monday through Friday, 8 to 4:30. So it's been very challenging, I must say. We've known for many years that we needed additional staff, and we have asked, but again, through budget reductions and those recommendations not being put forward, it did not occur. So our budget continued to be reduced year after year. So you are correct. We do not have a fund specifically for financial assistance. That's the majority of what people come to us for. We do a phenomenal job of calling other organizations and pooling resources, calling our community partners, reaching out just to any organization that might have funding that we can pull together to make someone whole. So they do a phenomenal job at that. And yes, this is the first year that I'm asking for 4 additional social workers. Now, is that enough? No, I know that. But I want to be good steward of the resources. And I want to make sure that when we ask for something, we utilize it and we get what we need. So again, thank you for that. I appreciate it.
A follow-up, do you have anyone on your staff who's not at the living wage level?
Andrew?
Yeah, I think we have 4 or 5 this year. We just got the spreadsheet from HR today that showed what we have, and I think there's a few that work in our nutrition program that will now get up to living wage because of what HR.
What they're suggesting. Mm-hmm. Okay.
Thank you for your question, comment.
Thank you. Are there other questions? Seeing none, I think that we are only an hour and 15 minutes past our finish time. We appreciate y'all sticking around, and thank you so much for all you do, and please let us know how we can support you further.
Thank you so much.
If we have other questions, we will direct them to to Ms. Pratt, and you can send answers to Director Darby over there, and they'll go on our Metro Resource page. Thank you very much. Please remember that wish list items are due tomorrow at 4, unless you have specifically asked for an extension, as some have. So let me hear from you. Thanks to all the people that have stuck around. We're adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.